our nervous system, when it's undergoing stress, is sending us attention signals. And it's sometimes turning up the volume on those signals, whether it's pain, whether it's an emotion, it turns the volume up and up until it feels like we're paying attention. And for
Mm.
us to notice and
Mhm.
attend and then learn how to make those shifts, it's within everybody's capacity. I don't think this is something that a human isn't able to develop.
All right. Hello, everyone. This is Anita Lwanga. I'm here with my new friend, Dr. Christine Gibson. I'm so excited to have her on the show. It's been a bit of a journey for us to be able to get together and be able to interview. But when we have speed bumps in the road, usually it means the topic is going to be good and it means it's going to be something that's very valuable. So I am so excited to have you here. And just before we started recording, we were talking a little bit about her background. So Dr. Gibson is a family medicine doctor. She used to work as a hospitalist, and now her focus is on trauma therapy. She actually wrote a book about this, the Modern Trauma Toolkit. So she has a wealth of knowledge to share with us. She has such unique experiences, and I'm so excited to hear about her. Dr. Gibson, please tell us a little bit more about yourself. Tell us about your journey into medicine and your journey carving a unique path to yourself, to medicine that is unique to yourself and authentic to you.
It's interesting. One of the things that we haven't talked about yet is I just finished a doctorate last year, and the subject was transdisciplinary study. And that is really like the essence of who I am. I'm a very deliberate transdisciplinary practitioner. So when I had gotten into medical school, my intention was to do pediatric neurology. I did all my electives in it. I was really excited about that subspecialty. And what happened is I loved everything. I did my clerkship and I loved every single rotation. And I kept thinking, like, am I never going to see a child again or an obstetrics case? And I thought I can't close any of those doors. And I went into family practice so that I could continue to be a generalist. And it was interesting because even within that, I've done hospital-based care, community-based comprehensive longitudinal family practice. And now I'm doing more episodic primary care plus trauma therapy. So even within family medicine, I've had a few careers. And then I think since 2007, I probably started studying and branching out and doing other things. So I did a master's in medical education and had an academic career running the health equity residency, briefly the associate program director for our postgrad training, many roles in the undergrad level. And then I had a global health academic career where I actually ran, I guess still technically run, a nonprofit called Global Familymed. So I've worked throughout East Africa and Ethiopia, Myanmar, Laos, and Nepal for 12 years. That nonprofit is winding down because I'm now starting a corporation called Safer Spaces Training, where we do skill-based training for folks around trauma and toxic stress and nervous system release. And then there's a new foundation with that. If you were to look at my CV, you're like, one person did that. But what I was trying to do, I think a lot, was to allow myself to be a transdisciplinary practitioner within medicine. So that's all related to medicine, but a lot of different paths. And that's been really rewarding and exciting.
Yeah, and I can see how it's rewarding because you're not just focusing on one area, but you're helping many different people. And sometimes I think when we're in medical school, we don't realize how limiting medicine actually is in terms of what we're doing to help our patients. And if we choose to specialize, the trend is usually to specialize and continue to specialize. And there's so much more that we know we can do for our patients, but we end up just feeling we're writing a prescription and we're like, okay, bye. And we know it's not often not enough. Or we do a surgery and we're like, okay, bye. Patients still have other questions. And we know that the medical model is not enough. So that's so beautiful that you chose to do a path that is not the common path that most people would choose, but it's a path that's authentic to you. And you know that you're giving your patients your all and you're giving them more than what a lot of us are able to give them. So yes, I agree. You said your CV. Yes, this sounds like a CV of 5 people put together. Where did you find the time to do all of this?
Yeah, it's a good question. I'm the quintessential lifelong learner. So if we look at like the CanMed's roles of what a doctor is supposed to be, like my is to be learning and sharing. I've always done that. From the moment of graduating, I was like, what else can I learn? What else? So I did a master's, I did a doctorate, I studied Ayurvedic practice. And then for 8 years, I've studied different kinds of trauma therapy. So this has just been a constant thread through. Oh, and in the middle of all that, I started studying social innovation and design thinking. So one of the things that I really loved about your comment was in medicine, we're encouraged to subspecialize and say that's going to fix the problem. The more that you really understand one thing. And what I've done is really pull out instead and look at a macro picture of medicine and health. And for me, the macro has been more helpful than the micro. And systems change, systems entrepreneurship, social innovation gave me a lot of skills that way. So I did a month-long residency in this and a certificate program. That was a really helpful lens for me to be able to look more upstream at the different causes, the kinds of things I would see in an equity denied community, and then look at the leverage points that I have a certain number of years out of practice, like 20 some, and then just my particular connections and network. So I became a TikToker because I was thinking, how do I leverage this platform that a physician can build? And I managed to build a huge platform on TikTok because people really wanted information about mental health. And the amount that I learned on there is phenomenal. So it's been very unconventional. And I think that macro lens has probably driven a lot of it. It's helped me move further and further upstream, which helps larger swaths of the community, like you mentioned.
Ah, that is awesome. And I applaud you for going on TikTok. So many of our colleagues are scared of social media, but I'm like, this is the place where our patients spend their time. And half the time, whether they tell us or not, they Googled something or they listen to some, I hate to say it, I don't, some stuff that is not true in polite terms, stuff that like, this is not true. And they got it from some TikToker. So we're the ones who should be on these social media platforms telling the patients the truth and telling them things that, are evidence-based. Not that we know everything, but I mean, at least pushing back against the misinformation. So I really applaud you for stepping out and doing things that most of our colleagues are not doing, or I'm not sure how your experience has been. If you've had negative feedback from some of your colleagues, I applaud you for stepping out and sharing information with our patients. And with that in mind, the next question I want to ask you is, what inspired you to write your book? Like that, already you're doing so many things, you're giving so much. But yeah, tell us a little bit more about how you decided to write your book, how you chose the topic, because you also have such a breadth of knowledge.
The Modern Trauma Toolkit never would have happened without TikTok. For us to get a publishing deal, especially nonfiction, you have to prove that you have a platform to a publishing house, which I never would have imagined. So it wasn't like I deliberately said, oh, I'm going to join TikTok and maybe that'll get me a book deal. I've been writing consistently most of my life, really. When I was in high school, I said to my mom, I want to be a writer. And she said, that's great. You should get a job and then write about that. Write about what you learned. Best advice ever. She's brilliant. So writing had been something I was doing. The reason I mentioned that I'm here in Canmore, Alberta, is because I'm doing a writing retreat to write fiction. But I'd been writing fiction for like probably close to 15 years before I got the book deal for nonfiction. And my agent and I had to pivot and say, okay, this is the first thing that you're going to write. And it was really the TikTok topics that drove it. So there on social media, I'm TikTok trauma doc. And so trauma really is the main focus of my channel, but it's trauma from that macro lens. It's not just what's the individual thing happening in your brain and your nervous system because of what you've been through. It's also, let's look at the ancestors. What trauma did you inherit epigenetically, but also what did they know about stress reduction that's been lost in modern times? And that was a really interesting deep dive for me to learn that so many of our cultures had community-based practice around singing or chanting or circle dancing where they processed a lot of stress in very evidence-based ways. And so I was learning that the myth of what we learn in medical school is that CBT, cognitive behavior therapy, is the panacea for all mental health concerns. And what I quickly learned once I started studying it, and what really resonated on my TikTok, is that the body and that the nervous system is really an effective doorway into managing stress. And most physicians don't learn these skills. So that one of the main audiences that I want to reach with the Modern Trauma Toolkit is physicians. And it's not necessarily that I wrote the book for them. It's a patient-focused book. I wrote it with really accessible languaging. I tried to make it non-triggering examples. The skills inside there are not what we learned in medical school. That's what I've been studying for those 8 years. And I'm trying to get that book into more and more hands of healthcare to say, you are managing so much toxic stress in yourself too. So like after that pandemic hit, Healthcare workers have not been okay. So the general public is manifesting larger stress responses, and so are we. So
Mm.
there's large groups of people that are public facing and interacting with a lot of stressed out humans, teachers, parents, lawyers, realtors, dentists, anyone interacting with the public right now is recognizing how much toxic stress is just out there. And so I wrote the Modern Trauma Toolkit to give them skills to self manage that and to co regulate, to manage that in relationships. Yeah, it's been an amazing journey. And the interesting thing about it is that book has been brewing in my brain for a long time because by the time I sat down to write it, I had the outline ready because that's what I had to give to the publisher to get the deal. The book just spilled out of me. The first draft came out in 3, 4 months. It was
Wow.
really, I knew exactly what I wanted to say.
Wow, wow, wow. For everyone who wants to check out this book, we'll make sure that we have Dr. Gibson's link below and make sure that you can purchase the book because I think it's something everyone can relate to, whether or not I think post-pandemic, people can say no matter how where you live in the world, I think everyone has faced some kind of trauma and more so life is life, right? Wow, I think that book, I have to find my way to make sure that I get your book and I read it myself as well because life is life, especially post-pandemic. So that is so incredible. And 3 months, that's really incredible. And the interesting thing too, you mentioned you're writing another book. Is it related at all? Or are you going to give us a few secrets or hints about what you're writing about? Or do you want to keep it
Well,
secret?
yeah, it doesn't have a book deal attached to it. So with nonfiction, you tend to get the book deal and then you write. Whereas with fiction, you actually have to finish the book and then pitch it. So
Uh-huh.
this book has been finished like 3 different times. It's been requested by publishers in different iterations. So if this book enters the public domain, it definitely does have some themes of this. The other thing I've been studying more recently is climate psychology. So this is in a very new genre called cli-fi. So cli-fi is climate fiction. It's also called eco-fiction or hope punk. And so this novel relates to climate psychology, and that is not what I had started it off as 15 years ago. The thread through it is also my ancestral background. My grandmother that had the most cultural influence on me was Ukrainian, and I took in Ukrainians at the beginning of the war. One lived with me for 2 years. And so I have this really strong connection. So when I was advancing my book into the future, what I wanted to do is to imagine not just how is the world dealing with the climate emergency that is already imminent, the stuff that's already locked in is what's in the book. What
Mhm.
are we doing about that now? And not in a very apocalyptic way, but like a practical way. And then I was also really curious about what does this look like in Ukraine? And all of this is the definition of post-traumatic growth. So there is trauma in the book, like that's definitely a thread through. And there will be some kind of manifesting of the different things that I've learned within my main protagonist. But what I was really interested in too is the collective trauma, things like the pandemic, the climate emergency, political divisiveness, and inequities, all of these things that affect us, that every individual is, I can't do anything about that. And one of the reasons I wrote the Modern Trauma Toolkit was to actually give community based solutions too. I have a whole chapter on social innovation and design thinking. I have a whole chapter on policy because that's what fixes trauma. It doesn't happen in the nervous system, it happens in community. And
Mhm.
that's another really big thing that we've collectively forgotten.
Oh wow. It actually sounds like you have a couple of books in you. It sounds like you have a lot more books. Just even with every topic you're telling us about, that could be like a whole series of books. Actually, I want to back up a little bit. You did mention something about epigenetics and how our ancestors' trauma can affect us. For individuals who are not familiar with what we're talking about, because I think our population or the individuals who are watching this are quite a wide spectrum of individuals. Some of them are in the medical field, some of them are the general public, and their medical knowledge is quite variable. So what does all this business about epigenetics mean, and what does our parents or our grandparents' difficulties have to do with us and our health today?
It's such a great question, Anita. I didn't know a lot about this because when I did my genetics degree before medical school, it was such a long time ago that this word didn't even enter the lexicon. Nobody knew what epigenetics was. And for me to start studying it like probably 12 years ago was when it hit my radar. I was like, this changes everything. So one of the things that I've learned in studying trauma is that some of it is pre-verbal. Like we don't actually have a language for it. And so pre-verbal can be before the age of 3. We can actually have trauma related to our own birth, but
Mm-hmm.
we also inherit trauma. And so there's modern studies on this, but some of the more longitudinal studies have been on animals. So they would expose a rodent to the smell of cherry blossoms, pair it, so that we could call this classical conditioning. You pair something so it's associated in their brain with a small shock, and they would avoid that smell. That avoidance, the avoidance of cherry blossom smell, went on for 7 generations of these lab animals. So they actually inherited the trigger. So this aversion, not liking cherry blossoms, is something that was inherited. So we knew based on lab experience that this was true. They've also studied Holocaust survivors. And what they uncovered was that there was a methylation in the DNA. So methylation is the chemical structure of DNA actually changed based on toxic stress that a person's having. So when you're undergoing stress and your body is stuck in it and it's pumping out cortisol and lots of things are happening in the physical body, it also changes your DNA. And that's what's inherited by your kids. So this doesn't mean that the story is locked in, because of course it's constantly changing. So what I always thought was you just inherit your DNA and that's it. And what epigenetics teaches us is your DNA is changing too. So what we pass down is also inclusive of our experiences and probably our parents' experiences, if not further up that chain. So some of the things that we don't know why we don't like it, and we have an aversion, we feel triggered by it, or we just are deeply uncomfortable at a cellular level. I just find it so fascinating, and it really should change a lot of what we know about medicine, both the epigenetics and then the other topic I love to teach more physicians about in terms of its impact on us is how childhood development and adverse childhood experiences affect absolutely everything. And it wasn't until I was in family practice doing comprehensive care and started doing trauma therapy work on my practice panel, who had every single one of them had really high levels of adverse childhood experiences, or ACEs, and their physical health started to improve. And I thought, wow, like by intervening at the trauma and these epigenetic changes they've inherited and rewiring the pathways of what happened to them as children, their diabetes improved, their asthma improved, and studies everywhere, including in Alberta, bear that.
Oh, I have too many questions. And I think I'm going to ask is, if negative experiences can affect us physically in our environment, can affect us physically negatively, is it possible that positive experiences can also have positive impacts on our health? And if so, are there certain things you'd recommend? And I'm also going to ask more about trauma therapy. But yes, are there certain things somebody can do in their own life? Say they don't have access to work with you or to work with a trauma therapist. Are there some things that they can do in their own life to improve their health and reduce the trauma response?
Yeah, this is the exact question that I ask myself daily. So I'm on TikTok for that reason. The Modern Trauma Toolkit came out for that reason, because people don't have those skills and capacities, and it can all be learned. For me to help these patients rewrite the pathway and improve both their physical and psychological health tells me that healing from trauma not only is possible, but it kind of alters the trajectory of a person's health experience. One of the best researchers and practitioners on this is Nadine Burke-Harris. So she was the first Surgeon General of California, and so much of her appointment was based on her studies of childhood experience. So her book is The Deepest Well. She is a Black woman in the Bay Area, and she was studying her community's experiences through the lens of ACEs. And she recognized two things. One was that the original ACE study was from 1999, and it was inadequately measuring the experience of the Black community. So she introduced things like racism and bullying into the ACE score and just expanded what was being studied, which was really key. I work in refugee health now. And so the original ACE study wasn't sufficient to show the determinants of health or the risk factors for the communities that I serve. So Nadine was really great at expanding it. And then she also does really focus on those positive experiences. So not just the adverse, but the positive. And so we call that the PACEs instead of just the ACEs. So positive and adverse childhood experiences, the word PACEs does that. And one of the illustrations in the book, I was really trying to think, should I lay out the original 10 ACE score that they studied in 99? Should I just reproduce Nadine Burke-Harris's diagram of all of the things that she studied and just attribute her And what we ended up doing was this really soft and beautiful diagram with mountains and sunshine. And those were representing things like community care and ancestral based knowledge and interaction with the land and all of those different positive experiences that are possible. And it's interesting from a physician's perspective is really all it takes is one safe adult to mitigate some of the things that are happening at home with your home-based caregivers. So for some kids, that's a teacher. For some kids, that's a doctor. For some people, it's like a community-based person that you're interacting with, your camp counselor, your pastor. We can be that one safe person if we understand enough about this as physicians. But if you're a social worker, like almost anything that you do when you're interacting with kids, you can be that person if you really understand what's happening and you understand how both to recognize what it is that's going on and then how to be a safest person as possible yourself. So one of the first things that I started doing when I was on TikTok is changing the timbre of my voice.
Huh.
So when I'm on TikTok, I speak in this really melodic and nurturing voice because one of the biggest things that helps our nervous system regulate
Mhm.
is something called prosodic voice or that melodious quality. The way you would talk to a puppy or a baby
Yeah.
is a really soothing thing for the nervous system. And
Uh-huh.
that is one small thing that everyone on the
Mhm.
planet could do if we knew better.
Oh, wow, wow. That's true. And I think even as physicians, we see our patients respond to the way we talk to them. If you come in and you're grouchy and gruff, people push back in the same way. Or same thing, if somebody's having a rough time and they're in pain, I think naturally, hopefully, most of us will change our tone, change our voice, change our approach, and we can definitely see people respond to that physically. And one thing you do talk about in your voice is healing practices. Would you classify this as one of the healing practices that you recommend people utilize, or is this a little bit different? And do you have other tips you'd like to share with us for healing practices?
Noticing the quality of your voice and adjusting it to help co-regulation happen is definitely a skill. It's not one of the 40 that's in the Modern Trauma Toolkit, but it's in there. It's definitely mentioned like why that might be. There's a chapter on something called polyvagal theory. I won't get into the details about it, but it's really what is our stress response. And
Mhm.
so much of the book is trying to give people those skills. So I have a whole chapter on how to use soothing touch. So one of the things that I was so surprised to learn about is there's studies showing that if we brush or like you're petting a kitten or a puppy, the palm of our own hand or our own shoulder or our own cheek or forehead, we actually create soothing brain waves. So
Mhm.
if they're measuring our brain energy, that's called an EEG. It actually, the activating energy, like the really stressed out, anxious, busy energy, that's called the gamma waves, those decrease,
Mhm.
and delta theta wavelengths or the calm ones that show that your brain is more relaxed, those
Mhm.
increase just with that soothing touch. So
Mhm.
what a simple thing to be able to learn. So I have a whole chapter on that because there's lots of different techniques where you can use guided imagery, you can use breath. There's all kinds of adjuncts that you can do along with the soothing touch. And that might not work for some people. Some people will like, I'm not doing that. That's weird. Then they can just stick with breath. And there's lots of different breath-based exercises there too. I've mentioned it, but I'll get into what are the cultural practices that are possible that you might or might not relate to. And the reason why I have 40 different skills in there is because everyone needs to personalize it. And first, you have to actually learn what happens in my body when I'm stressed. So that's the polyvagal chapter. There's an overactivated stress response and there's an underactivated one that nobody talks about. So we always think of fight and flight and the muscle tension and the racing mind, but nobody recognizes this is why my TikTok blew up that we also respond to stress by shutting down. Someone who's not getting out of bed, who's doom scrolling socials. And in physician language, we will call that person non-compliant and not adhering to the treatment
Yeah.
protocol without necessarily recognizing that it's a reflex-based stress response that's stuck in their nervous system. And they don't actually have a lot of conscious control over it. So we
Okay.
will throw some medications at it or maybe try some CBT and wonder why has this not been effective. So
Mhm.
I'm really trying to provide people that lens of self-compassion to help them understand their own stress responses, responses of those that they love or serve.
Wow, that is so powerful. And thank you for sharing that the fact that sometimes as physicians we misunderstand our patients' responses, especially this, as you labeled it, non-compliance. I've seen that as a diagnosis under past medical history. And then even if people have overcome that trauma or are no longer using that stress response, they have that label, unfortunately. So people have prejudgments, and we don't always take the time to sit down and figure out why was this behavior there. Okay, sure, maybe they were not complying in quotation marks, but is there something that happened? Is there something that happened in their family? Is there a reason why they're acting that way? So thank you for pointing that out. And I think that's very good and very challenging for us as physicians. And I think what you're doing is so powerful. And I think we as physicians, as much as we have our own stresses on us, I think we need to read your book with the intention not only of helping ourselves, but then also helping our patients and approaching them from a different point of view, from a different lens, and being more open and more understanding and having more curiosity and asking more questions to try and help them in a more holistic way. And going back to your work with patients, the patient population you work with, you talk about working with patients who are primarily refugees. How did you transition into working with refugees primarily? I know, or I have too many questions. We're going to have you back, but I have many questions, but I'm very curious about that.
It's a circuitous journey again. I was running this international nonprofits from about 2000. I guess the nonprofit really started in 2012, but I'd been working in Laos through a Calgary-based project prior to that since about 2007 or 8. So I studied tropical medicine in London a couple of years later. And because I was associate program director for family medicine training at the time, one of the students actually said that they wanted to create a global health residency. We call this an enhanced skills year. So they would finish family practice training and then they would do an extra year of learning, and they didn't have anyone to run the program. So they threw that in my lap and said, "Hey, could you create a global health program?" And I got really quickly overwhelmed. And it was interesting because I'd been doing lots of teaching in the hospital, and I had on my radar a master's in medical education out of Scotland, which is where my dad is from. And so it was really fun to pivot and say, okay, like I'm going to run this post-grad training program with a lot of help from my grad studies department. So learning how to create a program that was flexible, yet rigorously evaluated, but allowed every single student to study the thing that they wanted to do. And so many of them were interested in immigrant and refugee health, and there was a very defined skill set. And because of the hospital where I was working, I had developed some of those competencies within myself, and then you add the tropical medicine part to it. So to work in the refugee clinic in Calgary, we have a really super skilled group of practitioners, and they've all studied tropical medicine. And most of my students ended up working there. So it was really interesting when I left the hospital, I was transitioning out of my community practice, and all of my former students were actually running the refugee clinic. My classmates from the diploma of tropical medicine was the program lead there. So it was like coming home to my people. It's like all of my students ended up working in this environment, and now they were teaching me how to do that. So it's been really amazingly rewarding. And what's been particularly cool for me is I just started off doing primary care in the refugee clinic, but as I was studying trauma, I was recognizing that we didn't have enough resources for all of the event-based trauma that the refugees had encountered and continue to encounter, because settling is not an easy thing to do. So then I turned the lens of trauma as well as the lens of primary care at the refugee clinic, and I've been doing both there. And I also do trauma therapy in adult addictions, which is another thing that was a very common coping strategy, and I'll say it that way, in my family practice, because they had such intense amounts of adverse childhood experiences. Many of them used substances to cope. And so I think a lot of what I'm showing in the Modern Trauma Toolkit is that you can do something similar to your nervous system the way that substances help. And I think as practitioners, we're constantly being told, like, this substance use is bad. And I don't really think of it that way. I think of it as effective or not effective. It's doing something for them, or they will be doing it. And really what it's doing is it's helping them manage trauma. So unless I can give them replacement skills and say, this is also helpful, can be hard for them to come off that substance because it's doing something. And I love how in your summary statement you use the word curiosity because that's really what it is. It's just shifting the lens from what we're taught in medical school, which is what's wrong with this person, and kind of
Mhm.
pathologizing them. My question that I ask now is what's right? What's right about this person? Why does this make sense? When I'm thinking about their behaviors and the way that their nervous system is responding to stress, which includes substance use, like why does that make sense? Something they're doing. And when you ask with that curiosity and compassion, it's such a different question and it's really a different answer. And then you recognize like it's hard for them to come off that substance unless they have a substitute way of self-soothing. And that's really what the Modern Trauma Toolkit was providing. And I wish I could give that to every single refugee coming through. The reason I do it as a physician is because I'm a bit of a limited resource. I'm free and I'm a trauma therapist. Whereas if you're in community, good trauma therapy tends to be like 200, $250 an hour. So I ended up in these equity denied communities because I'm a free resource that has a huge toolkit on managing PTSD and complex trauma.
Wow, that is so, I don't even have words. I'm so amazed, so impressed, so touched. Like my family, or like I'm a first, I don't know if I can even call myself first generation, but my family immigrated to Canada when I was about 6 years old. So a lot of
Mm.
what you're saying really resonates. And it's not an easy thing to choose to work with refugees because you never know what you're going to get. You could get people who have had an easy transition or people who have had a more challenging transition. So I really applaud you for choosing to work with immigrants and with refugees. I'm just going to sneak in two more questions. I want to respect your time, so we should probably wrap up our recording. I'm going to have you back. Maybe the first question I'm going to ask you is, how can people work with you? Do you work exclusively with refugees only in the Calgary area, and do they have to be referred to work with you?
Unfortunately, there is no pathway to work with me, sadly. So that's why I'm trying to do the systems change work at that kind of macro level. So I wrote the Modern Trauma Toolkit. I'm on social media. And if TikTok disappears, I'll put it all on YouTube.
Good.
And the company that I'm running, Safer Spaces Training, we're
Mhm.
actually going to be launching some online skill-based training. Um,
Good.
I think like right now we're workshopping the Unbothered series, but how do you get to unbothered? And we'll also be launching some family medicine training programs to teach them more of the skills that I've learned. And certainly not the 12 years worth of skills, but there's so many different things that you can incorporate into your practice that take 30 seconds, 1 minute to teach a small skill on nervous system regulation to your patients. And I just feel like all physicians should learn this. So I'm really interested in creating educational curriculum. I'm working with a teacher who's actually turned my book into high school curriculum.
Oh,
So I'm really looking at how do I get this message out at a systems level? And I don't do a lot of extra one-on-one work right now. I have 4 different jobs, but none of them really have a referral pathway unless you're in Calgary's addiction program that I'm associated with, or you come as a refugee in the public sphere to Calgary. There is no pathway to work with me, but I'm opening up pathways for systems change. I love to do speaking. I love to talk to groups of teachers or physicians or realtors about toxic stress and what you can do to manage that. That's the main way to work with me is sorry, my dog is snorting behind me. So if you hear
that's so good.
snuffling, oh, there he's
He's
shaking
happy. You can see
his
him.
little tail. So if you hear snorting sounds, that's the puppy deciding to let me know that he needs attention.
Oh,
And that's really what I'll use my dog as a segue is our nervous system when it's undergoing stress is sending us attention signals. And it's sometimes turning up the volume on those signals, whether it's pain, whether it's an emotion, it turns the volume up and up until it feels like we're paying attention. And for
mm,
us to notice and
mhm.
attend and then learn how to make those shifts, it's within everybody's capacity. I don't think this is something that a human isn't able to develop. So I work with folks in their 70s who can still make these shifts. So this is my hope is to help broader swaths of people gain this understanding and learn how to make those shifts so that all of us are regulating our emotions better. And I don't want to say that because that can be a really harmful phrase for neurodiverse folks. There's no one right way to be in the world, but it's a way that's tolerable for you. So that's why I want people to personalize it and say, these are the things that I'm struggling with, self-identify that, and then find the solutions that work best for them. There's no one right way of being, but a lot of us are struggling.
Oh, wow. I love everything that you're doing. I love your heart to just help people. And you're so selfless in everything that you do. I see that even with the extra training that you're doing, it's not about you. I can see that your intention is generally to help people and to help make the world a better place. And I can see everything you're doing is definitely making the world a better place. So I want to applaud you. I know it takes a lot of time, it takes a lot of long hours, and know that everything you're doing is making a difference. Thank you so much. And I'm going to have you back on the show. That's going to be my last question. Will you be willing to come back?
Oh, yeah, of course. Yeah, absolutely.
Awesome.
And thank you, Dr. Lwanga. I feel like you're really asking insightful questions and getting to the meat of things. So thanks for putting this message out there for your community.
Oh, it's my pleasure. It's my pleasure. So, for everyone who listened to the show, we'll make sure that you're able to get a hold of Dr. Gibson's material. We'll link her TikTok handle so you guys can follow her. And we'll make sure that when her course comes out, which I think is fantastic and super exciting, we'll make sure that we share it with you guys. And we'll make sure to have her back. Bye bye for now.